My symptoms were constant headaches, almost migraine. I had shoulder pains. I had neck pains throughout here. It burns. I had shoulder pain in this shoulder. But just every day I had a headache, and it just always came on like mid-morning, early afternoon. And I always had to take medication for it, always. With my asthma symptoms, it just didn't work well. It just made me miserable. I had to take a nap every day. I had to lay down for at least 30 minutes, just subsiding the headache pain. And then I had to get shots in my shoulders and in my neck, in the back area right here, just so it would stop. It was just miserable. Tried over-the-counter mouth guards. I do clench. I find myself clenching all the time. So I thought maybe the mouth guards would help me with that, because it was all connected in some way, because I clenched, the pain, headache. The mouth guards didn't work out. I went to my doctor's. Again, I had shots in my shoulders, cortisone shots, and it just seemed nothing. And then finally I did go to a dentist, and he made a mouth guard, and I chewed right through it. I clenched. I clenched so hard it went right through it, so it didn't work out. And they took impressions and spent a couple $100 on it. It didn't work out because that's what was recommended by many people, and nope. Then I had orthodontics when I was at an older age. I was in my 20s. I still wear the retainer, thinking that may work, but no, nothing was working. I didn't want to go to doctors anymore. I was tired of the shots, discouraged. Nobody can help me. I'm going to be stuck with this headache forever and a day. My kids, were just feeling my pain, my wrath. Yeah, it just wasn't a happy camper. I was losing like hours because I couldn't go on. I was working out, and I had to stop working out because I get headaches afterwards. And I think that had to do with my clenching, because I clench during my workout. So at least hours, two hours if you want to nail it, because I had to lay down and couldn't do anything, couldn't function, just to get rid of this headache. I was looking forward to going to bed. Yeah, I was angry. I was not happy. I met Dr. Deldar back in 2013, working somewhere else. We met, and I jokingly said that I was a dental assistant. He goes, "Ooh, come work for me." I said, "Great." So he offered me a position here, and over time, I was seeing patients reminding me of the same symptoms that I had, and I'm like, oh my goodness. And I would watch the process of what he was doing with them and how he was helping them, and they would come back and they're like, oh, this was changed my life. So I'm like, okay, let's do it now. So I just chose him, and that's how it worked out. The process is very easy. I mean, it can't be any simpler. It's non-abrasive. I have to say that again, non-abrasive, okay? He would hook you to this computer and things like that, and it just shows your muscle spasms and what your muscles are going through, and then he tends you, which relaxes your muscles, and you just sit there and enjoy it because it feels good. And then knowing the outcome that this orthotic is going to change my life, and then delivery, 2 days after delivery, everything was just clearer and happier, no more headaches. Yay! I cannot go, it's been a year, I cannot go a day without it. I take it out just to clean my teeth, and I can start feeling everything coming back. I put it back in, it just, maybe subconscious, I don't know, but I wear it 24/7. So it's in my mouth right now as we speak. Nobody notices it. The only time they notice it is when I'm taking it out, maybe cleaning it out with some food. Oh, what's that? It's my orthotic. It's helping with my headaches. I stick it back in. They're like, oh, I never known. Nobody will ever notice that you have this miraculous thing in your mouth helping you with any type of pain in your head whatsoever. I don't take as much medication. I don't go to the doctors as often as I should, maybe. I only go for my physicals. I have no shots in my shoulders anymore. I feel like I have no pain. I can work out normal. I still clench my teeth, but knowing that I have this orthotic, I could do that without worrying about what's going to happen or am I going to have to lay down in the afternoon. I could do that, and I still clench. I'm happy, and my kids are loving it. My husband's loving it. Everybody loves it. I'm not hating life anymore. It's his knowledge, his ongoing continuing education and his knowledge. It outbeats everybody. I mean, it by top notch. He is knowledgeable with the whole cranial TMJ. You're not going to get anybody better in the States. Seriously, you're not. He's just, because continuing education is important to him. And then don't forget his chairside manners. Cares for his patients. I mean, he'll care just beyond the caring for his patients. You're going to get it.